So for this examination, I'm using now the UCT 180 from Olympus company. It is linear endoscope.
Oh, really?
Yes. Okay, that's good enough. And again, I would like to extend the mucosal incision from here and
Switch to ultrasound.
yes. And setting the foot pedal intermittently, I can make a nice mucosal incision like this. And white ceramic tip is staying on the surface, and we can recognize the blue line.
Შეგახსენებ მეგობრებო, რომ ამ შემთხვევაში პირველი ეტაპი ეს არის ენდოსკოპიური სუთა ენდოსკოპიური და პროფესორი ზივალდი გაგავიდა ენდოსკოპიური პრობლემაზე.
This is the aorta, and I'm advancing the endoscope. Here you can see structures of the pancreas. So I'm retracting the scope, and now I try to find this lesion. So actually, in such a case, we would first perform radial ultrasound, but this is not available, but this is not a problem, because here with the radial echoscope you can more nicely have a better anatomical overview. But I think here in this case, we can enlarge a little bit, bigger.
How about the surface of this tumor?
Okay, so this
kind of
is the lesion. Now we fix, freeze, and then we will measure the lesion. So this lesion is about also this diameter. So this is a relatively small lesion. So it is only
But in case of using
1.2 by
it's mandatory to use crystal violet staining.
1.5 centimeters. It is an ecopore lesion.
Because of the potential risk of having carcinogenesis by using crystal violet.
Same in Korea.
You have here nicely the different layers.
Unfortunately, maneuverability of the endoscope is really
I think here,
poor. Okay,
and we have something to show.
Because of the
here you can nicely appreciate this is the muscularis propria, and the tumor is here originating.
Still, we can do procedure like this and gently touching to the blood vessel and.
Αυξητά του τραπέζι κοντρόλες και shumotasებულია საფუნქციონენსი წარმონავში. Stefan.
Okay. So now we have negative pressure with a syringe, and now I'm trying to move within the tumor. And this is also now a little bit tricky because the position is not so good. The tumor always moves with me. So I really have to grab tissue. And in leiomyoma, the diagnosis can be only made by histology. So if we have other cancers like pancreatic cancer, cytology is sufficient, but not in leiomyoma. And the differentiation between leiomyoma and GIST also needs immunohistochemie. So that's why we need good material. So I'm moving here. So what I'm doing, I'm vanning, as it's called. So I try to get first here on the top of the lesion. Then I'm using the big wheel, moving a little bit and trying to get also material from the lower part of the lesion. But you see always the tumor is moving with me, but sometimes I have such a click and then I know I get material. So the nurse checks if blood is coming, but in this case it's not such a big problem. Okay, so now I'm carefully removing. Wait. First, we put the needle out. Okay. Yes. So I use now, so we can use the Olympus needle 19 gauge. I use now the 20 gauge Cook needle because it is made of special material, nitinol, and it is relatively soft. Where is this here? Okay, this. First here. Yes. Here. No, wait. First,
Slowly.
No, wait. First the needle. So first we are pushing forward the needle. Moment. At 2 centimeters.
Okay.
And now, now I have the needle here, and now the nurse is introducing the stylet.
Slowly and gently. Material is coming.
Yes, I think we have, now I'm looking for whitish pieces, and I think we have some material. Okay, we inject a little bit air. So I think here's some material in. Okay, wait, retract the needle, yes. And then we also have some blood in the syringe. This we will also put in a, yes, in another cap. Okay, so I think we got material, and you can proceed also maybe with Professor Yahagi, because we will puncture again, because in such case it is very important to have a lot of material, and that's why we puncture again. And yes, and I hope that we finally get the diagnosis. So I expect this is a leiomyoma. It's a small leiomyoma. Patient has not the symptoms from the tumor. I think patient has symptoms from the reflux. And we hope to get a diagnosis. And if it is a leiomyoma, we also don't need to follow up this patient, because we can be sure that this is a benign lesion with no indication for do anything. I know that Dr. Yu removes such lesions, but if it is a GIST, there is an indication, but not for leiomyoma. Okay. Okay, we'll do the same. Perfect.